The Health Minister, Dr Joe Phaahla, has encouraged community members to vaccinate to fight all kinds of illness. Dr Phaahla was speaking during the World Immunisation and commemorative event in Mangweni, Nkomazi in Mpumalanga. The event forms part of government's efforts to promote immunisation and highlight the benefits of using vaccines. Our reporter Nkomazi was there.
Mpumalanga, Limpopo and KwaZulu-Natal are the three provinces most affected by malaria. The Nkomazi area, which borders Mozambique and Eswatini, also have a high prevalence of the disease. Young and old people alike were vaccinated for various diseases at the local sports ground. We are on the border with Eswatini and Mozambique, and people cross over these countries. The malaria people who visit our homes to spray do tell us that the disease kills. I was here to immunize my baby. I think that's very important. According to the SADC Elimination Aid initiative, member countries have signed a declaration to eliminate malaria by 2030. The disease is reported as the biggest killer in the region.
I mean, you can't really contain a mosquito very well. Mosquitoes don't need passports to cross countries. Mosquitoes, I can go Mpumalanga, I can go to Eswatini, and then I can come back, and that's how malaria starts moving across borders. And so it's really trying to contain the vector and the mosquito, but also beyond that, making sure that everyone has access to a health facility.
Community members have been asked to cooperate and support officials in the fight against malaria. Residents were also encouraged to open their homes to malaria prevention methods by government.
We are worried when we hear that some households they don't open their houses when people who come to spray against malaria and mosquitoes. So we're encouraging people that they must open their homes when it is the time for spraying. But also when you feel some illness, which can be malaria, it can be sometimes very confusing between COVID and malaria. So come forward to be tested, both COVID and malaria.
The health department has also urged the residents to work with government to deal with deadly but preventable diseases across the country and the province. Nkomazi, SABC News, Nkomazi, Mpumalanga.
According to SADC Elimination 8, many countries have come together to fight malaria. The SADC countries have signed a declaration to eliminate malaria by 2030. The disease is reported as the biggest killer disease in the region. SADC signed the declaration in the wake of World Immunisation Week. And World Immunisation Week aims to highlight the collective action needed to promote the use of vaccines to protect people from succumbing to treatable diseases. Earlier, I spoke to Phelele Fakudze, who's Head of Policy, Advocacy and Communications at SADC's Malaria Elimination 8, all about immunizations in general. Phelele Fakudze, the Head of Policy, Advocacy and Communications at SADC's Malaria Elimination 8. Thanks very much indeed for joining us, and welcome to the program.
Thank you. Thank you for having me.
So this is an important week in terms of immunization awareness. How important is it to have this Immunization Awareness Week?
I mean, super important. We are alive today because of immunization. We've come from a place of polio, measles, rubella, pink eye, all of the things that we suffered as young children. So this is an important week because immunization has so many dynamics to it. There's government investment, there's public interest, there's, a reluctance, there's religion into it. There's really a lot of dynamics, but really the prime thing about immunization is saving lives. And I think that's why it's such an important week for us to commemorate and bring light to, because we really are trying to save lives, especially the lives of little children under 5.
And I guess over the years, we've taken it for granted, but that's why a lot of the diseases have disappeared and some are almost not with us anymore because of these programs of immunization, and some have to have been compulsory as well, I guess.
Yeah, I mean, the issue of herd immunity comes into play, right? Vaccination, we have to remember that vaccination is an individual intervention. I go to get vaccinated, but immunization and herd immunity is really gathered at a population level. And so it's very important for us as a population to garner herd immunity in order for children that are still being born, children that, may fall out of the spectrum, to be able to be protected. And I think that's really the key to understanding this. It's saying, me going to get vaccinated, yes, it is protecting me and my baby from a certain disease, but in the greater scheme of things, it's building herd immunity for a population to not to have resilience and not be able to infect future children because we have garnered this herd immunity.
What have you found in terms of compliance? I mean, of late, COVID-19 has presented quite a number of issues in terms of people not wanting this immunization. Has that affected traditional immunization programs?
Well, I think we have to recognize, like in any campaign, any health campaign, traditionally, vaccination immunization has been with children, right? Newborns. And so it was often the burden of the healthcare centers and the mother who's just given birth to ensure that they leave the hospital with a vaccinated baby. So now COVID-19 comes and spins the wheel and says, hey, adults, we are changing the game now. Adults have to be vaccinated. And this is not something that we're behaviorally used to as adults. And so this is where the conundrum comes in, because that's where you get the reluctance. Reluctance comes from adults. You can't get reluctance from a newborn baby because the mother is sort of, you can get it from the mother, but, it's sort of a policy thing, right? And so when you bring COVID-19 vaccination into the spectrum of things, you are injecting adults with a thing. And adults now have the autonomy to be able to decide what they want to do with their bodies. They also need more information, precise information that comes in the way that they understand it, to be able to get a doctor to inject something into them, right? So I think that's where the reluctance comes from. But I also think it's important to note that reluctance also comes from distrust of government mechanisms or policies, or the lack of, I don't trust this enough. Is this going into my body? I need more information. And so the way that we package campaigns, vaccination campaigns like COVID-19 for adults is very, very different from how we package it for newborns.
As a continent, we've done well with issues like polio. We saw a case in Malawi recently, and the government has acted quickly there to try and contain any possible spread. How are we doing across the continent in terms of dealing with things like polio? We really should have gone by now.
We have done well. This is one of those cases. I'm a malaria person. I work in malaria specifically, but I'll liken it to a case that came through a plane in London a few years ago, maybe a decade or so ago, that was called the airplane malaria, or something funny came out of it. There are those one in a instance cases that will arise. That does not mean that vaccination and immunization has failed. It just means that we, in order to be able to protect the population, we have acquired a certain percentage of immunization to protect the population, but we have that does not mean that there will not be 1 or 2 cases every 10 years, every 5 years. And eliminating a disease really means removing the risk of getting it locally on a daily basis. That's what elimination means. But that doesn't mean that if South Africa has eliminated a disease and Namibia has not, for example, that with the cross-border and migration and people flying out, and it does not mean that that parasite or whatever vector that disease comes in, whatever shape, could be a mosquito in the case of malaria, could be, other things, viruses in the case of COVID-19. It does not negate South Africa. It does not protect South Africa from dealing with that case. So when we talk about elimination and eradication of a disease, we are really saying locally we have eliminated the risk of acquiring that disease. But someone can fly from anywhere and bring it in, and we need to have the systems to be able to prevent reintroduction into our population. And so the malaria case that you cite, the polio case that you cite from Malawi is one of those instances, very rare, but possible. And I think our systems have been designed well enough for polio to be able to contain that and not allow it to become another epidemic.